Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. Today I want to bring forward a study published by the American Thoracic Society on July 20th, 2012. So the study showed that smokers who had higher vitamin D blood levels had better lung function over a 20-year period than smokers whose vitamin D blood levels were lower. So here's how the study was done. As part of the normative aging study, researchers examined the relationship between vitamin D blood levels and rate of lung function decline in smokers over a 20-year period. Now, the study involved 626 Caucasian male smokers. The researchers noted that vitamin D sufficiency, what they considered to be an adequate amount of vitamin D, a blood level that's at or above 50 nanomoles per liter, that individuals that had that kind of status had a protective effect on lung function and the rate of lung function decline. Now, these findings were based on vitamin D levels that were assessed at 3 different time points between 1984 and 2003, and lung function which was assessed concurrently using spirometry testing. So according to the researchers, and I quote, "Results suggest that vitamin D might modify the damaging effects of smoking on lung function. Now, these effects might be due to vitamin D's anti-inflammatory and antioxidant properties." End quote. Now, the researchers did not comment on the ability of vitamin D to reduce the risk of lung cancer, but the study suggested that sufficient vitamin D status appears to slow the decline in lung function associated with smoking. Now, this has important implications regarding the prevention of smoking-related emphysema and chronic obstructive pulmonary disease, or COPD. As such, it appears that smokers should have their blood level of vitamin D evaluated. If the level is below 50 nanomoles per liter, then vitamin D supplements are likely a good idea, and try to get that vitamin D back up above 50 nanomoles per liter. Of course, the best thing a smoker can do is to quit smoking. It's unlikely that higher vitamin D status can prevent lung cancer. Remember that 87% of lung cancer is linked directly to cigarette smoking, so smoking cessation remains the ultimate goal. However, until smoking cessation occurs, smokers should know that achieving a vitamin D blood level of at least 50 nanomoles per liter may help to slow or prevent decline in lung function linked to emphysema and chronic obstructive pulmonary diseases. Now, as a final comment, I would say if you put all the studies together that we've seen on vitamin D, most of the studies show that it's best to have a blood vitamin D level that's at or above 85 nanomoles per liter in regards to the prevention of cancer in general, osteoporosis, multiple sclerosis, and some other degenerative diseases. So I like to see a blood level in a patient that's above 85 nanomoles per liter, not above 50, but above 85. So I think that all adults should really aim for a blood level in this range, remembering that vitamin D toxicity doesn't occur until you get to a blood level around 250. So I've included a link to the research study in the text below. So until next time, thanks for watching, and I'll see you soon.